Welcome and thank you for joining us. I am Pana Poto. I'm a senior family educator at INCLUDEnyc. I am also the parent of two children. I have an 11-year-old son who's on the autism spectrum, and I also have a 2-year-old who has a speech delay who also gets speech services. So this topic today is very important to me. We're going to be discussing speech and language development in young children. So I want to tell you a little bit about INCLUDEnyc. INCLUDEnyc is an organization that serves families of children with disabilities here in New York City. And as I said before, our topic is speech and language development in young children. I want to introduce our guest to you, Dr. Leslie Grubler. Leslie, can you tell us a little bit about yourself and the work you do at Lehman?
Sure. I'm the Director of Clinical Education and Clinical Services at Lehman College, which, as you know, is located in the Northwest Bronx. We are a facility that is a training facility on the grounds of Lehman College, and we provide training to our undergraduates who are studying for their bachelor's in speech pathology and audiology, and for our master's students who are studying for their master's degree in speech language pathology. The facility is quite large. We're in 2 floors. We have almost 20 rooms, 20 treatment rooms. Presently we treat about 175 clients from the ages of 11 months to 81 years. We have a variety of clinics, specialty clinics, and they really run the gamut, and it's an exciting place to be, an exciting place to work, and also an exciting place to help people. I can tell you a little bit about the clinics as well.
Yes.
So we have an aphasia clinic and an adult neurogenic clinic which treats individuals with aphasia and also Parkinson's disease. We have a language and literacy clinic which is both monolingual and bilingual for school-age children. We have an across the lifespan clinic which meets the needs of individuals 0 through adulthood. And then we have the early childhood clinic which meets the needs of children 0 to 3 and also preschool 3 to 5. So we
That's
do
a really
great many
nice
things.
variety.
Yes, yes.
Variety. So today, thanks so much, Leslie. Today is one of a series of live stream presentations that we air here at Include the 3rd Thursday of every month. We're going to try to keep it under 60 minutes. We will be using a chat box, so if you have any questions, please leave your questions in the chat box. We will try our best to address your questions as we're going through, so if you ask about a topic that we're already going to be talking about, we'll answer it that way. Otherwise, please save your questions till the end, and we'll be sure to leave some time for questions at the end. So today we're going to be talking about speech and language development.
My favorite topic.
Yes, so I know you talked about the Lehman Clinic, and the Lehman Clinic means a lot to me because my daughter has received services there, and all the students there have been wonderful. I always rave about your services that you provide. So this topic really means a lot to me. Speech and language development, I find, is one of the first things that parents notice in their children, right? So for the average parent, they may not know about, if their child's fine motor skills are developing properly or gross motor skills, but they will know if their child's talking or not, right? They will know if their child's making sounds, if their child is communicating with them in any kind of way. So how best can parents track their children's speech and language development?
Yeah, so it's important to truly emphasize that speech and language services are typically the first deficit area that families notice. It is the service that is the most highly requested.
Yes.
So we tell our students, because it's the reality, that speech language therapists, speech language pathologists are on the front lines of helping individuals with special needs. So we go in and we start an evaluation process with a family, and we may find that they need fine motor assistance or gross motor assistance or special education as well. And we're able to make those referrals for additional evaluations. So in terms of how can parents, collect those benchmarks, well, there are a great many developmental milestone charts. Certainly ASHA.org, ASHA being the American Speech, Language, and Hearing Association, provides a developmental checklist with all of the various milestones, particularly for speech and language. MedMD, also developmental milestones across many domains. So not only occupational therapy, physical therapy, speech-language pathology, and others to assist parents.
Mm-hmm.
It's also important to note that medical doctors, like pediatricians, particularly developmental pediatricians, can provide guidance in terms of how a child is doing, but sometimes it's nice to consult with the child's daycare provider, the child's teacher, those in the child's environment, friends, relatives. And I think parents also have to take note of the fact that, does my family have a history of speech and language difficulties? And the other piece, we talk about nature and nurture. The nurturing piece has to be there too. Right. So if you're with your child and your child is playing, narrate that play, be engaged with them. So it's a combination of nature and nurture, which we really have to look at.
And we have a resource packet as well that's going to be going out, so it's going to give you some additional resources that you can use to be able to track your child's speech and language development. And it's so important because you said that speech therapists are on the front lines, right?
Yes.
So when it comes to my son, it was because of his lack of speech that we even referred him to early intervention before we even knew that he was on the autism spectrum, because we noticed that it wasn't one of those situations where he was talking and then he lost language. His language development pretty much stayed the same. It kind of plateaued, and we realized he wasn't saying as much as other kids his age. So we referred him to early intervention when he was 2. Now with my daughter, I was watching her like a hawk because her older brother is on the spectrum, and I want to make sure that I don't miss anything with her. Right. So at 18 months, we were already on it, right? Yes. And it was actually the folks at Lehman who suggested to us, after we had her evaluated there for speech, that we refer her for early intervention services. So now she's been getting services through them.
So I appreciate you bringing up early intervention services, because it's really quite the program, particularly in New York City and throughout the state of New York and across the country as well. It's an important program for children 0 to 3. Parents can access that program quite readily by just dialing 311. Yes. And, I'm very proud of the fact that the Speech and Hearing Center at Lehman College is also what we call a New York City EI academic partner. So our students are trained in best practices in early intervention to best meet the needs of families. So, and you know how important family engagement is. Definitely. Between the years of 0 to 3. So.
Definitely. And one thing I want to tell parents, if you refer your child for early intervention and they're not found eligible, you can always wait a few months later and apply again. Because when my daughter was first referred, she didn't qualify, right? But I was able to get the services for her the second time around. So let's talk about red flags. What are some of the red flags that some parents should look out for? Because I know, especially with boys, a lot of times people might dismiss them needing help because they would say, he's a late bloomer, boys talk late. I know my husband didn't talk until he was 4, right? And now he keeps talking. but I'm glad that I followed my instinct and I still got my son the services he needed, because I was like, he doesn't need therapy. I even had a teacher tell me, he doesn't need, why is he getting this service? He's a late bloomer, those kinds of things. So what kind of red flags can parents look out for?
Yeah, so I think certainly, we talk about red flags, we have to talk about developmental milestones. And we know that between the ages of 0 and 12, children give us a lot, babies give us a lot in terms of communication, even though they haven't even said their first word as yet. Gestural language, the ability to follow you and gaze at you with their eyes, to smile back at you, to respond to your facial expressions, and also to respond to changes in your voice. So you know how we speak to a baby, we don't necessarily say, hello, how are you? We're speaking to a baby saying, how cute you are, look how little you are, you're smiling again, I love you so much. And all of that, what we call mother-ease or father-ease or parent-ease, is very important. And we look at the baby's face and the baby is responding to us. Maybe they're even smiling a little bit. all of these pieces are communication, even though it's gestural communication.
Right.
So we have to look for that, particularly between the ages of 0 and 12 months.
Right.
You know, when you talk about autism spectrum disorders, we know a lot about autism spectrum disorders. However, we're still not diagnosing it early enough. So if we know what to look for in terms of the developmental milestones, we'll get ahead of it.
Right.
So 0 to 12, lots of gestural communication, but also cooing and babbling, what we call reduplicative babbling, so ba 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 ba, da 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 da. And then it starts really sounding more language-like, where parents will say to one another, or family members will say to one another, did he say mama? Did she say dada? We're all hoping for that, right? And so it's becoming more language-like as we head towards 12 months. Then between 12 months and 24 months, we see some more language growth, whereby children are beginning to put two words together as we get closer to 24 months. Around 12 months, a child should have about 2 or 3 words. About 15, 18 months, they should have about 15 to 20. At 2 years, about 50 words, 50 to 70 words. And then as we get closer to 3 years, maybe 250 words, and 4 years, almost 500 words. And throughout this period, a child's length of utterance, how many words they string together, is also getting bigger. So 1 word at 1 year, 2 words together at 2 years, 3 years together at 3 years, 4 words together, and then larger sentences where at 4 and 5 years of age you can have a conversation with the child, which it's so beautiful.
Yes, definitely. So, you know, we usually pay attention to verbal language development, right? Because a lot of parents, oh, my child's not talking, when is he going to talk? How important is it for parents to really be mindful? I know you have to talk about gestures, right? So can you expand on that a little bit about how important nonverbal communication is?
I think the best way to communicate this is to just think of ourselves as adults. 60 to 90% of adult communication, if you can understand and process this for just a moment, is gestural language. 60 to 90%. So we're communicating joy in many ways, sadness, just by our facial expression and our body language. And so we have to apply that same kind of thinking to what our children are doing. And we have to ensure that when they are communicating something to us non-verbally, that we are paying attention to it and acting on it as well. So there's so many different ways that we and also that children communicate non-verbally. Step back from that. What happened before this nonverbal communication? What could the child's body language and or behavior be telling us? And we have to assume and accept that all behavior is communicative. You know, gestural language, it's all communicative. And, you know, like I've said before, even though within the first 12 months a child isn't verbally communicating, certainly their behavior is communicating a great deal.
They're saying a lot. So, what are some examples of ways that caregivers can encourage language in their children, in their young children?
So, you know, I often say that we have to find the child within each of us and nurture that. So it means being comfortable with the silly. We have to get out of our adultness, you know, just get out of it. And remember what it was like to be a child and to play and to want to play, because, you know, Mr. Rogers tells us that a play is the way a child learns. And it is the way a child learns. So we have to be willing to play with our children. Get down on the floor. When they're talking to us even, we shouldn't be standing above them. Get down on one knee. Be at eye level.
We're so little and we're all the way up.
And I'm taller than most people, so I have to be ever so mindful of that, to get down on my knee and be at eye level and just listen. Give them eye contact. Listen to what that they're saying. We don't always have to correct, and we don't always have to be correct. We can just do active listening. I remember when I was a graduate student, one of my professors said, I want you to play with this child, but I don't want you to say anything. Just zip it. Just listen. That's all I want you to do.
Yeah.
And I found it to be very difficult, but it was a great exercise.
Yeah.
If we listen, we can then respond appropriately,
Yeah.
right? So I think just being present fully, giving a child attention, finding the silliness inside of us. So for instance, I was playing with a child the other day, and we were playing with a ball and a box. The box opened up, the child was putting the ball in the box, and I would close it, right? The child wanted the ball. So open, we're playing open, right? And then we started putting other things in the box. He was taking things out, but we were having essentially a ball,
right,
you know?
Right, exactly.
Just playing with a box and a ball, and I was narrating the play. So ball in, close it, open. Everything that I was doing, I was narrating. Everything that he was doing, I was narrating. Another way to help children develop language is through books. I brought several of them. So here's one, right? We know this one.
Yes.
Brown Bear, right? So, you know, we open the book, beautiful rainbow colors, and certainly we can talk about them. Look at red, look at blue, look at green. Where is that white? Can you show me white, Pana? Show me white. She found the white. Now I might say to her, is that white or black? I think it's black. And then Pana might say, no, it's white. Perfect, right? So we haven't even gotten to page 1.
And
already we're having, we're already having fun.
Yeah.
So now I see a bear. And I can go ahead and read the words of this story. I can say, brown bear, what do you see? I see a red bird looking at me. Or I can just say, bear.
Yeah.
Right? Look at that bear. I don't have to read the words of the book.
Show the picture.
Correct. And then when the child gets really used to these words, I can say something like this. Red bird, what do you
see?
Very good, Pana. You're very good at this.
I don't know about singing, but I'm trying.
I see a yellow duck looking at
me.
Very good. And so that's called the close strategy, CLOZE, where a child is filling in the blanks.
Okay.
Here's another book. It's called So Big. It's our very favorite Sesame Street character, Elmo.
Elmo.
Right? And he sure does.
Yes.
And look, he's nice and red, and his pictures are on blue and yellow background, and we certainly can talk about red, and we can talk about Elmo.
Yeah.
Look, there's Elmo. Or I can say, it's Cookie Monster, and everyone knows Elmo.
Right.
So that child is likely to say, no, Elmo, right? And then we can turn the page, and Elmo's doing all sorts of things. He's eating a banana, right? He's sitting in his high chair. Maybe it's something that one of our families would like to see their child do. Sitting in a high chair, eating a banana. He's playing with a toy. He's reading a book. And he's laughing. Look at that. He's giggling. And I'm not even reading the words.
Just explaining what you're saying, yeah.
He's smiling. He's shaking a rattle. He's playing hide and seek, peekaboo. And look, then we ask the question, how big is Elmo? And look at that. So big. How big is Elmo? So big. How big is Elmo, Pana? So big. Very good. So, and there's just, there's so many other books, bilingual, bicultural books that have both English and Spanish in it. There are big books as well. And here's a beautiful big book. This is, again, another piece of classical children's literature, I Went Walking. And it's very similar in words to Brown Bear. Actually, it was the predecessor of Brown Bear. And it says, I went walking, what did you see? And there's so many beautiful animals in this. And as a speech-language pathologist, typically these books would be used in group, like in preschool or early childhood. But I don't have to do that. I can use this with one child, and we could be on the floor reading this. We could be on our bellies going through each page. So, in terms of working with a child and helping them develop speech and language, nurturing that child within is so important. Finding that silly, getting down to their level, doing active listening. I think all of those pieces are so important.
Thank you. I was taking notes. Because I could learn a few things from this with my kids. So we know there are some children, who may have developmental disabilities such
Yes.
as autism. They may have speech delays. Speech
Yes.
development may be difficult for them. What can parents do in addition to the steps you've already outlined to help their children who may have difficulty accessing language because of their disability?
Yeah, so first off, it's so important that if a child is having difficulty, that the parents seek an evaluation,
Right.
right? Get that evaluation. If they're 0 to 3, it would be through early intervention. If they're 3 to 5, it would be through the Committee on Preschool Education that is offered by the Department of Education.
Right.
Get that child evaluated. When services begin, it's important to work with the speech-language pathologist that's assigned and all of the team members.
Right.
For 0 to 5, we know that that is the critical period in language development
Right.
when 80% of a child's, 80%, the child's brain grows to 80% of its adult size.
Right.
So look how important that is. 80%
That's a big
happens
jump.
0 to
Yeah.
5, and it is why they call it the critical period. But critical to that is the teamwork. We have early intervention, we have team-based work, we have to work with the team. So not only will the skill set that I bring as a speech-language pathologist help a child, but I need to be consulting, as does the family, with the rest of the team as
Right.
well, with the family members being part of that team.
Right.
So we have to listen to what the OT says in terms of accessing toys,
Mm-hmm.
right?
Yeah.
So maybe an inappropriate toy for a child who has weak hand motions is any toy that you have to point or
Right.
tap. Maybe they can't do that yet.
Yeah.
So maybe there are other toys, bigger toys that you have to play with. Physical therapist also, maybe this child can't manage a playground well.
Right.
We would have to know that
Yeah.
to be able to enable an adaptation,
Right.
right?
Yeah.
So much of what I shared in terms of working with children for a child with speech and language
Right.
difficulties
Yeah.
are the same kinds of procedures.
Right.
For a child with autism, it might be the use of visual instruction,
Right.
to
Yeah.
help them along. They might need that visual, something that says, I want juice, for them to point to because they can't verbalize it.
Right.
We know that 50% of children with autism may never have verbal language.
That's a lot.
So we have to give them another mechanism, another means.
So, as you said that, I want to kind of expand on that a little bit, because we get calls sometimes here at Include where a parent will say, my child's been receiving speech for a year or, a couple of months, and he's still not talking, right? Because they're measuring their success or their progress on them being able to have expressive language.
Right.
Can you talk a little bit about receptive and expressive language and how important each of them is?
Yes.
Yeah.
Mhm. So a little bit of definition. Receptive language is understanding or comprehension.
Right.
Expressive language is what a child says.
Right.
And so we have to consider both when we are thinking about enabling a child to develop verbal language.
Right.
Is the child understanding what the parent, loved one, caregiver, teacher is saying?
Right.
And we know what a child is understanding. So if we say something like, get your shoes,
Mm-hmm.
and the child walks over, picks up their shoes and brings it to you, they understood that.
Right.
If you say to them, where's your cup? And they point, they've got
They
it.
understood.
Right?
Yeah. Mm-hmm.
And understanding is very important because typically receptive language precedes expressive language. It's almost like that cup has to fill up with that receptive language and spill over until you get that expressive language.
Right.
It doesn't happen in every case,
Right.
but in most cases that is how it happens. So one of the most important things is, do you feel your child is understanding what
Right.
you're saying to them? And if the answer is yes, that's good, right? If the answer is no, certainly we want to take a look at that and explore it more through evaluation.
Right.
We may even want to explore it more if the child does have receptive language.
Right.
We want to be sure that we're providing the necessary supports so that expressive language does come in.
Does come out.
Sometimes it requires treatment services. Sometimes it just requires giving a parent guidance on how to.
What role can assistive technology play in this, right? Because you said like 50% of children with spectrum may never speak.
Right.
But I've heard of adults, who are able to use assistive technology,
Yes.
and they're communicating just as well as anyone else.
And in today's world, because of computers, because of iPads, that world has been so broadened, and that's wonderful too, because, I remember 10, even 20 years ago when devices were typically only from AAC companies or, alternative and augmentative communication companies, and the devices themselves were about $8,000 to $12,000. They're still that price, but at least we have other alternatives like the computer or the iPad to supplement it. There are some families who have a bias against using an alternative or augmentative device, and it's an important topic to address, because the idea is that visual language, visual instruction, AAC devices can enable the development of language. That repetition, we know that children and people learn through repetition, so if they're constantly pressing these buttons and getting feedback, so it says, I need juice, or I want juice, or I want shoes, whatever it is, they're hearing that feedback all the time. There's more of a chance that they're going to produce as well. And so we have to look at it in some cases as an intermediate step to language. In other cases, it may be the means that an individual will have. I'll tell you a little story. I was working with a 26-year-old woman who was at the developmental level of a 3-year-old. She loved Coca-Cola, if you can imagine this, right? So she would always ask on her device for, I want Coke. And she would ask her dad, I want Coke. And he would say to her, okay, Christina, I'll get you your Coke. He wouldn't jump. Now, as a speech-language pathologist, I would want that parent to jump, because if she's using the device, we want her to continue to use the device. So you have to be responsive. So she would get a little frustrated, and during the course of our session, I noticed that. So I said, Christina, should we develop another way for your dad to get this Coke a little quicker? So what we put on the device was this little statement. She would press it, and it would say, I don't like to wait. So she asked for her Coke, I want Coke. And her dad said, okay, Christina, I'll get it for you. That's okay, let's give me some time. And then she pressed, I don't want to wait. And he turned around and he looked at her. She's giggling. He went and got the Coke. He got the message. Right. And so it's just so important that if we have these devices, if we have visual instruction available, that we use them. We can't read minds, right? I think about what my students share with me, that, a parent said that, well, I know everything that my child is thinking. Can't know everything, and I say to my students, do you think your mom knows everything you're thinking? She goes, no way, gratefully.
We can guess, but we're not going to be able to guess everything.
And in not guessing everything, we're limiting our children.
So some of our children, they may script, or they may exhibit some speech as they repeat everything you say. Can you talk a little bit about this? Because I know sometimes the scripting, like for my son, sometimes it's within context, and then sometimes it's just him. He's just repeating something that he heard over and over and over. Is this something that parents should try to decrease, or just kind of roll with it? How can parents address scripting?
That's such a good question.
Echolalia.
So echolalia, and it means speech sounds, speech repetitions, and it is the repetition typically of verbal language. And I always say my rule of thumb is it being done in a socially appropriate way? Is anybody being hurt, or is it not socially appropriate? And I look at those parameters before I make a determination as to, with the parent, what we can do about it. In some cases, we might be able to say to the child, okay, let's talk about this during this time or after dinner. We may be able to hold it off so that there's a certain amount of time that kind of behavior is socially acceptable. I had a child that I was working with in a school who would always say, from the first minute she walked into school, I want lunch, I want lunch, I want lunch, I want lunch. What she was actually wanting to say was, when is lunch?
When is lunch, yeah.
And we were able to put together a schedule, a class schedule, that highlighted, okay, first we have circle time, and then we have book time, then we have tabletop, then comes lunch.
Right.
And the behavior decreased as soon as she understood where lunch was in her day.
That schedule, yeah.
Now, I then further thought, why is she so invested in lunch?
Right.
And then I saw her lunches, and they were pretty amazing.
Yeah.
You know, I would be asking every minute, you know,
Right.
when's lunch? When's lunch? Because her mom just made these perfect lunches with these fruit on the side and snacks and a great drink. I mean, it seemed to go on forever.
Right.
So, but you know, seriously, there are circumstances that occur where it's just not appropriate.
Right.
Echolalia, perseverations as well,
Right.
where a child has to touch something, you know, 5 times, and before they can stop touching it.
Right.
And so maybe we want to produce a visual schedule that gives them the opportunity to press 5 times.
Right.
It says 1, 2, 3, 4, 5. 5, you know, 5 times we take the number 5 off. Now they get to press it 4 times,
Okay.
take the number 4, 3 times, 2, and then 1, it's done.
Right.
Each case is different. Each child is different. No child is the same.
Right.
And we really have to look at it in context. I was at a presentation where a child, where the presenter was talking about stars, and there was a child in the audience who loved the song Twinkle Twinkle Little Star. Every time the presenter said the word stars, you would hear the child say, Twinkle Twinkle Little Star. She was making the connection because she heard that word. And yes, it was definitely a perseveration going on and on and on. And she needed time. She needed a time and place to sing that song.
Yeah.
But it really requires some analysis, you know?
Yeah. So, another thing I wanted to talk about is perseverations, right? So you had talked about those. And I know, you know, sometimes they can be disruptive, as you mentioned.
Yes.
Is this something that parents should actively try to work on to decrease?
Yeah, in some cases, yes, and in some cases, no.
Okay.
You know, if we can talk to the child about it.
Right.
So I worked with a child who would do this, had to do this all the time.
Right.
But he was aware of the fact that he was doing this.
Right.
And he shared that it was out of his control. He couldn't control it. So in working with his OT and his PT, myself, we created like a shaking hands time. And he was able to do it as frequently as he asked.
Right.
Is it my shaking hands time now? If the answer was yes, he could do
You
it.
got to do it, yeah.
It really depends on context. It really depends on the severity of the perseveration, how often it happens. We had a child in a school program once who he perseverated on the curtains that were, the shades that were on the windows. He could not leave the curtains, he could not leave the classroom until the curtains were at a certain level. They each had to be equal, and there were 6 different curtains. So the teacher was very smart. She didn't make a big deal about this. She just gave him the responsibility of curtain man.
Yeah.
And at the end of the day, the curtain man had to put the curtains down, and then he could leave the classroom. So, you know, I had another child who he would do this all the time.
Right.
You know? And we were able to talk to him about it. So what are you doing when you do this? He said, I'm tickling the air. Right? So who would think of doing that?
Right,
This was his activity.
Yeah.
And so at least he gave a name to it. So we would ask him during class if this was disruptive. You know, Johnny, is this tickle the air time or is it not tickle the air time? You know? It really depends upon what the behavior looks like.
So one thing I like that you said is instead of trying to just say stop it, we try to understand why the child is doing it, to try to meet them where they are and incorporate it into their routine.
Right, yes.
Yeah.
And, you know, you're talking to a speech-language pathologist now who's a developmentalist.
Right.
And however, there are other ways and other providers of service who could have other ideas. And so that's why I'm saying the team is very important. An occupational therapist in the treatment of children with autism is a critical member of the team. An ABA therapist is also a critical member of the team because they may have another way of looking at this that could resolve this problem with no harm. Right?
And I think the word team is very important because I think it's really important for all the providers to be in communication with each other. And I think the parent is the common denominator with that.
Absolutely.
Because they can make sure that everyone is talking.
Yeah, think about a child who's in a school program.
Right.
Those providers of service are essentially working in a vacuum unless they have talked to that parent, unless they have an ongoing relationship with that parent.
Yeah, that's definitely true. So we have some folks that are listening in today who have children who are getting speech therapy, right? So they might be getting speech therapy through early intervention, they might be getting speech therapy through their child's preschool program.
Right.
What can parents do to help their children get the most out of these services?
Yes, they have to be present. That's so important. Parents are our children's best advocate. They have to feel that and believe that and see themselves as leaders of the team. They're not followers, they are leaders. And every team member should consider them as a leader. There's a lot to learn from a parent. Providers come and go. Parents are the stakeholders. Everyone needs to understand that. So being present, advocating for the child. You know the child best. You know what the child needs. Be that advocate. I often say to my families, be a bulldog. Don't give up. Do not give up. Do what you need to do in the best interests of your child. You know, I often think to myself, if I was a child with special needs, I would want him or her as my parent. Because those parents who take the steps to advocate and get involved and see themselves as a leader and believe that they are the leader of the team, their children do better. It takes a little bit to get to that point. But organizations like Include New York City help that process along.
We definitely do. And one thing I want to say, you know, just in terms of being the leader of a team, you don't necessarily have to go into an IFSP meeting or IEP meeting and announce I'm the leader. You know what I mean? You just kind of set the tone that, you know, this is my child, I know my child best, and I'm going to advocate for my child so that he can get what he needs and she can get what she needs. And also staying informed, I think. Going to workshops, learning as much as you can, talking to other parents as well can definitely help.
And you know, every school typically has either a system online where you can write in questions to your teacher or the therapists, or they use a communication book. So make sure if they write something to you, they want to tell you something really fabulous that your child did, respond to it. On the outside, if you know that there's something not quite right with your child, maybe he didn't sleep last night, he hasn't been eating well, communicate that as well. Because for our providers, that will inform them as to why maybe he's not having a good day.
Those are great tips. One thing I found too to be helpful is, you know, if you're having a meeting and you need to discuss a specific service, meeting with the providers ahead of time, just making sure everybody's on the same page. That definitely helps, because you don't want to bring up a problem for the first time at a meeting and the speech therapist has no idea that you had this concern. So I think it's very vital just to keep the lines of communication open with all the providers, including the speech therapist.
And you're absolutely right. You know, we're a we as a team. The I's don't exist. We have to function as a team in the best interest of the child.
Definitely. So another question I have is, I wanted you to talk a little bit about how parents can carry over some of these techniques that you were talking about today at home and in the community.
So in early intervention, most of early intervention services are home-based. A greater percentage are home-based than are center-based, and that's a very big plus. If a parent or a caregiver can be home with the child when services are being conducted. In New York City, early intervention, it's a family-driven program. and best practices are what are taught to providers and what are expected of providers. So that includes two very important pieces: embedded coaching, and also routines-based intervention. So embedded coaching means that the parent is with us on the floor. It doesn't mean that the parent is in the room. It means that they're with us, engaging, sometimes leading the play. You know, like I said before, parents are the experts in their child, right? And so a provider might not necessarily know what the child likes and doesn't like. The parent can provide all sorts of insight in that. Center-based EI is a little bit more difficult. In most cases, parents are invited, and certainly if you're invited and you can go. Be part of the classroom environment, learn the classroom script, so to speak, so that you can maybe imitate it at home as well with your child. You can observe and get involved in all of the techniques and learn them. Because the reality is, treatment services are what, 2.5 hours a week, 3.5 hours if you're lucky?
It's not that
That's nothing in the life of a child. You're with your child 24/7, or another caregiver is with your child frequently, and that's the individual who should be sitting in on the sessions and learning the techniques, etc. To use. And they're, you know, some of them are not very difficult. You know, child says something, they say you say right? Child is babbling, you're imitating their babble. The child is pointing, you're giving them the words for that. So it can be fun, and it does again mean that you have to find that child within you. Some of our families, they said, they look at our students and they say, like, how do you just like play with Play-Doh with them? Or, you know, you're putting your hands in mush, how do you do that? And so the student will go, come on, we need your hands in here too, you know? And before long, they find the child within, and they realize that, you know, this is what we have to do. They're kids, they're not adults. We've got to play, we've got to get at their level, we've got to meet them where they're at.
Yeah, and I think too, like, it has to be like a constant reminder that we give ourselves as parents, because sometimes we get so caught up in the everyday routine. Like, you go to work, you come home, you're in the kitchen cleaning up, and next thing you look, it's time for bed.
It's
so it's just trying to make sure that we squeeze in that time to get on the floor and play with them and be present. And it can happen during anything that you do, right? The talking. So you know that there are certain things you have to get done during the day. Your child can be there with you doing it. Maybe you're doing laundry or all of those lovely tasks that all of us like to do, right? And you can be talking about, oh, look at this blue shirt. Here's a towel. I can't believe this is a red towel. And you're throwing it in the bin. Whatever it is, you can be narrating your work, and you are also assisting your child in their language development. So 0 to 5 and 0 to 3 and 0 to 5, you have those opportunities. But to answer your question more succinctly, in learning the techniques for carryover, if you're not getting those techniques, if you're not getting activities to do, ask for them. It won't take your speech language pathologist or your OT or your PT long to put together a nice little home packet for you to do things with your child that mimics, that imitates what they are doing in the school environment. Because even for my son, I mean, he's 11 now, but I try to stay in contact with his therapist, and I always ask him, what can I do at home? You know, I remember in working with a young child who, he was almost 5 years old, he was 4. I was struggling as a speech language pathologist, trying to find, what is he interested in? I tried everything, and I felt unsuccessful. But I would meet with mom every morning at the beginning of the day, listen to what she was saying, what she did yesterday, etc. And one day, I felt like I hit the jackpot, because she said, you know, my sister bought him a jacket. So I said, yeah. And she said, and he loved it. So I said, well, why did he love it? She said, because it was green. He loves green. And I was like, thank you. Thank you. My therapy, everything in my therapy became green. And the little boy, when he saw all this, he looked down and he looked at me like, you finally figured it out. But, you know, it's listening. It's asking questions. It's being attentive. It's caring. It's being passionate. It's wanting to see change. It's wanting to help a small child and their family as well. So we want to open it up for questions now. I don't know if anyone has any questions. Is there There's no questions so far? Okay. So we'll just keep talking. When it comes to, speech and language development, because in the beginning I had said that, with expressive language, it's one of the first things that a lot of families notice. What do you advise families to do if they notice something is wrong and they're trying to get help for their child and nobody's listening? Like say they may have called early intervention, or they may have called the Department of
Well, that's
Ed.
a great question.
Yeah.
I think you talked a little bit about it earlier when you talked about your experiences with your daughter. Like, you were so concerned about her, you brought her to early intervention, and they said she's not eligible for services.
Mm-hmm.
And so it's important for families to know that just because early intervention deems the child ineligible, recognize that they have certain standards of eligibility as well. Mm-hmm. So in the case of New York City, the standards of eligibility for instance, speech and language intervention is there must be a 33% delay in just that domain.
Right.
If it's just one domain that there's a deficit in. Mm-hmm. If there's more than one, if there's two domains, then there must be a 25% delay in each of those. Mm-hmm. 33% delay and 25% delay is a big delay.
It's big, yeah.
So even though your child is deemed ineligible, it doesn't mean you stop there.
Right.
There are many universities, Lehman College being one of them, that offers free services. We offer free speech and language services. We will gladly accept the EI evaluation. We will not ask to reevaluate the child.
Right.
We will gladly accept that evaluation. And even though it might be less than a 33% delay or a little less than a 25% delay, and enable our students to work with them. It's important to note also that our students are supervised by a licensed and certified speech-language pathologist. So it's important that you not stop or not convince yourself that, because they've been deemed ineligible, everything must be okay, because it may not be okay. And having someone else take another look is a good idea.
Yes, yeah. Okay, so it looks like we have a question. How do I monitor my 10-year-old speech? We're doing speech in school and at home, but there are still struggles with her words, such as something she doesn't say. She doesn't say the sound.
So she doesn't say the sound. Yeah. So I think, we have to ask the speech-language pathologist for explicit instructions as to how we can elicit that sound. It's not an easy sound. Mm-hmm. It's a later occurring sound for most children, and I understand why parents would be particularly struggling with that, because it's noticeable and it's a common sound as well. Mm-hmm. So I would get explicit instructions from the speech-language pathologist. You can also do a little mirror work with a child. Get a mirror that stands up, sit at a table if your child will do it with you, and demonstrate where the tongue is for that sound. And we know that it's a little bit on our upper teeth here, and we're blowing out the sound. So there's also pictures of what producing the TH sound looks like, and you can pull those off of the internet to get some assistance as well.
So one thing I'm thinking too, I'm not a speech and language pathologist, but I'm thinking too with trying to help them make that sound, is it going to be helpful if they try to make it fun as well?
Oh, absolutely.
So as opposed to just saying,
right. Oh, yes.
Like, if you make it a fun activity, it'll be easier to remember.
Yeah, everything has to be fun. You
right.
know, even from little ones to school-age children to adults. It all has to be fun. If it's not fun, who's going to be motivated to do it?
It'll be hard to remember, to retain.
Will a 10, 11, or 12-year-old want their mom or dad working with them on the production of this sound? Likely no.
Right.
So, but getting the assistance of the speech-language pathologist, who perhaps could model for you or give you some fun things to do, or give even your child fun things that they can do in front of a mirror.
Right, and then I'm thinking too, once these techniques can be put in place, then some specific goals can be created.
Absolutely.
That can be put on an IEP so they can work on it continuously.
Yes.
Okay. So we have another question. How to support language with dual learners?
So, our facility is in the Bronx, and 60% of the patients that we see are Spanish speaking.
Right.
They're dual language learners in most cases. Not all, but most are bilingual. We have a very diverse population of clients, but also a very diverse population of students and student body as well. It's important to recognize that bilingualism is a really good thing, because bilingualism will enable more cognitive development. So, many years ago, parents may have felt that, I just want my child to speak English. I don't want them to speak the language of my country.
Mm-hmm.
And when you minimize the language of your country, you're also minimizing your culture, minimizing your family as well, and that's not something that we encourage. So we want to bring in both languages. We may be using bilingual and bicultural books in treatment. Your child might be placed in a bilingual class as well. They might be better in one language than in another. We'd like to get them both up to speed. But typically, they would be working with a bilingual speech-language pathologist. And bilingual speech-language pathologists also have the credentials of BE after their name and their MA credentials.
Okay.
So it's important to note that.
Okay. Because I know I've heard this from parents. Some of them might feel like, if I speak French to my child at home, he's not going to learn English, so I'm just going to speak English.
So they have to let that go.
Right.
Right?
Mm-hmm.
And make sure that they are providing both.
Okay.
Think about it. When your culture is so important to you,
Mm-hmm.
you want your child to share that culture. Let's say, I don't know, painting is so important to you. Wouldn't you want to bring your child into that world?
Right.
And how wonderful it would be if your child started painting. Maybe baseball is important to you, right? Wouldn't you want your child to enjoy baseball, so maybe when they get older, you could go to a baseball game together?
Mm-hmm.
So, your culture is who you are. You want to bring that culture to your children. We do many evaluations in the Speech and Hearing Center. I can't tell you how many times when we do the initial intake, the families don't reveal that their child is bilingual. And we find out during the evaluation. It's not a problem because we provide bilingual evaluations as well.
Right.
But there's still that hesitation to reveal that there's bilingualism.
Yeah, it's interesting. Anyone else have a question? I think that's it. So I want to talk a little bit more about the bilingual, because I find like when my daughter had her speech evaluation, she was at a daycare, and her teacher in the daycare was Hispanic. So she actually had a bilingual speech evaluation, which I thought was interesting.
Yes.
Because they feel like if the child is exposed to language, because at the daycare they're speaking both.
Yes.
And she was actually answering some of the stuff that she was being asked. I was like, I didn't know
Of course she was.
I didn't know you knew Spanish, but yeah, she knew a few little words, which I thought was great. Okay, so we have a child. Okay, we have another question. How to support a child who was not found eligible for early intervention, but there are global development concerns and the delays are becoming a behavior challenge?
So I would want to know a few things. How recently was that child evaluated? If 3 or 6 months have passed, it's time to get the child reevaluated. Typically what early intervention does is they place a child who is deemed ineligible, but there are still concerns about on what's called developmental monitoring. And the parent is requested to contact the early intervention provider agency at 3 or 6 month intervals to check in, and then determine if another evaluation is necessary. It also depends upon the age of the child too. If the child is heading towards 3, then the entity that would take over would be CPSE doing the evaluation. But certainly you should call that EI agency and request a reevaluation. In the meantime, what you can do is bring that evaluation to any university clinic, and like I said to you, Lehman College is a free clinic. There are other university clinics who are free or they charge nominal fees, but I would get that child help, also considering that you feel as though that there are global developmental delays and now behaviors are manifesting. I think your concern is warranted.
Yeah, because and what the parent added was that the child was evaluated twice in a 6-month period.
Okay,
Yeah.
and still deemed ineligible. So, you know, I'm concerned about that, and I'm concerned because you're concerned, and I would take it further. You know, there are additional steps, and maybe you can talk about the additional steps that if you're not happy with the EI evaluation, there is mediation.
There's mediation. You do have due process rights if you disagree with the evaluation results and the decision that was made. You can reach out to your regional office. So every borough has a regional office for early intervention that you can reach out to. If you need help navigating that, you can definitely call our helpline. I'm going to share that information at the end. Okay, so we have another question. How can you distinguish the difference between a speech delay and a child who's learning dual language, another language?
Yeah, you know, for children who are bilingual, oftentimes early on in the development of their language, one or both of their languages may be delayed, and that's called a quiet period, and it's very much typical of early language dual learners. And a speech-language pathologist will be able to identify that through an evaluation because they will be testing your child in both languages. And remember, they'll also be testing receptive, or understanding and comprehension, as well as expression in both languages. And so it's important in that case that you do get a bilingual speech and language evaluation. If, in fact, you can't get a bilingual speech and language evaluation, the speech-language pathologist will know that they need to have an interpreter present to assist in the evaluation as well.
Okay. And then we have one more question before we wrap up. How could teachers support both ENL and speech delay in a child who does not have an IEP?
Teachers, now we're talking.
Yeah. How can teachers support?
Yeah. So, you know, I think teachers have to be good advocates as well.
Yeah.
And if in fact this child does have a speech delay,
yeah, because I'm wondering why they wouldn't have an IEP, or at least be evaluated to see if they're eligible.
Right. So I think we do have to go down that road.
Yeah.
But let's say that this individual did, and for whatever reason they were deemed ineligible. So, you know, advocacy. There's a program that the DOE has that it is called RTI.
Yes. Response to intervention.
And it is not services, but it's kind of like preliminarily working on these deficit areas to make a determination as to whether this child does in fact need services.
Right.
It's ongoing support. So I would see if your school is a participant in RTI, and certainly get that child something. Speak to the speech-language pathologist assigned. I know that in some DOE schools, or schools in general, there is not a resident speech-language pathologist, but one who travels between schools. So you might want to make an appointment with that person, get some ideas from them, because they will have the opportunity to observe the child in real time and can best provide you with supports. And also the parents. I'm grateful to this teacher who has stepped forward and said, you know, hey, I have a child in my class who has a speech delay but isn't getting services. More power to you. Very proud of you. Thank you for being on this live stream. We need all teachers to be advocates as well, and helping the parents too. Some of our parents don't know the roads to take.
And that help is definitely needed. So we're pretty much wrapping up now. We just want to thank everybody who tuned in. We want to thank you for all your questions and for listening. This is actually going to be our last live stream until we return in September. So remember, it's the third Thursday of every month. So that third Thursday in September, we will be back for INCLUDEnyc Live, conversations on parenting and disability. Thank you, and thank you, Leslie, for joining us.
My pleasure.